I now call upon Dr. NIRMAL FREDRICK to speak on the topic Addressing Medico-Legal Problems of CPA 19 with Accreditation Standards.
Good morning, friends. Thank the chairperson and AIOC for this wonderful opportunity. And so my topic is on the preventive measures. The previous speakers have made my job easier. So this is my disclaimer. I'm with the honorary capacity with NABH. And I'll be talking to you about how we can address medical legal challenges, both prevention as well as safeguarding our interests and our hospital interests with the accreditation standards. As you all know, medical errors do happen, and many times it's accidents, and sometimes it is incident. And we have to know why this happens from the right perspective. The relationship of medical errors to negligence, and why do people sue their doctors, and what could be the potential solutions to the problem of medical errors. So there are so many other professional services as well as industries. But this question often comes to our mind. Why is medicine so susceptible? Since we are in medicine. So the basic thing is lack of awareness to the problem. Not only from our point of view, also from the general society point of view, there is a blame culture of silence. So many times the good people maintain a silence, and this culture of silence makes the other to blame and shame mentality. And there are system constraints. Ours is a underdeveloped system, infrastructure issues, staffing problems. There is a huge fatigue, particularly post-COVID, and knowledge requirements that is not addressed properly in the medical curriculum. Communication and continuity of care is not addressed. And human error is one concept that is extensively studied in other industries, but unfortunately not well studied or analyzed in medical field. So this occurs due to incomplete knowledge and the tendency to apply rules to simplify problem solving. This is what exactly happening in our country, where they want to regulate us too much without understanding the basic issues. So errors in healthcare must be accepted as an accident. This is what the concept as a society we have to promote to the other industries. We have to do the root cause analysis and see what is the root cause analysis and see how we can address the system flaws and not shame and blame the profession. So unless we do this, find the root cause or offer solution or institute preventive measures, this litigation is going to increase in our country. All errors are not negligent. I think this we have to enforce, not only among our professionals, but also to the other industries. And not out of so millions of hospitalization, there are only 1 to 2% of negligent injuries. And how many sue the care providers? Hardly 13% of the negligent injuries results in a claim process. So even though the numbers are limited, but it has huge implications on our practice pattern. And reason why people sue the doctors, basically the passing comments by another doctor. So one of the doctors is responsible for another doctor's issue, and there are now the legal profession is also needing money out of our accidents. So why patient complains? When they see that the standards or tenets are not followed in the day-to-day practice or perceive that they are not followed. So very often it is instigated by another medical professional or care provider, and they know that standards are everywhere. They compare the standard with other industries. And happy patient don't sue the doctor. So we know that. So what are the basic tenets of healthcare and accreditation standards? Safety, avoiding injuries to patients, no harm. That should be our motto. Effective evidence-based medicine, patient-centered, respect their dignity, rights and responsibility to the individual needs and values. And it has to be timely. Most of the complaint happen because we have not provided timely care. So we need to reduce delays for the receiver and provider, and it has to be efficient and equitable. So these are the unique challenges in our specialty. Basically outreach services, we reach out through the surgical camps, cluster infections happens, and this is widely reported in the press and media. Daycare surgery and follow-up issues. So previously we used to admit for 3 days or 5 days. The patient is under care, and it's also possible to take care of the accidents or poor outcomes. But with daycare surgery, this is becoming an issue. And variety of service patterns, paid services, free services, and charity unit, they tend to compare paid services with the free or charity services. And of course, insurance, as Dr. Inder Mohan said, it's compounding the problem with reference to documentation and follow-up issues. And the technology and advancement, premium services come with premium cost. Quality has its own cost. So unfortunately, patients don't understand. And we also spoiled ourselves by giving over promise and under delivering the outcomes. So why we are ignorant as a professional? We are not this has not been part of our medical curriculum. We are not taught about medical legal challenges. Nobody wants to talk about it openly, even if they receive a notice. Feel it may not happen to us. This is the major problem. So we'll deal with it when it happens, and at that time it is too late. So there are two issues with reference to medical negligence. One is the act of omission, and another one is act of commission. So act of omission is all these 6 important points: not performing essential tests, not giving appropriate advice, counseling, or informed consent, not maintaining aseptic precaution in the OT, not asking about the drug sensitivity and systemic disease, ruling out ocular pathology, and not seeing that the patient is furnished with proper records. So wrong side, particularly ophthalmology, hits the incidence of wrong side errors, which is absolutely preventable. And these are the root causes: the miscommunication in the OT, incomplete patient assessment, verification policy not followed, and these are the common complaints. And majority of these causes of wrong side and side surgeries are preventable. So how we can do that? Providing standard of care. So we need to take steps to prevent these incidents and accidents. So basically 4 important topics: failure to comply with legal and professional responsibilities, problems related to medication errors, the administrative errors, as Inder said, it's a tariff and billing related issues, and of course inadequate consent and medical records, which the next speaker will be covering. So failure to comply with legal and professional responsibility, we need to have certain system, and we have to minimize the government regulation and also the rates for which we have to comply with that. And this is becoming a big problem for small-time practitioners, and the compliance is becoming difficult because of the red tapeism and corruption in the system. So with accreditation standard, this is followable. This is the standard related to the licenses, where there is a mechanism to regularly update licenses, registration and certifications, and this becomes a responsibility of top management. The third issue is the biomedical wastage. So this is another critical area where Pollution Control Board has been given huge powers to seal and inspect the premises at their will. So we have to comply with those regulatory requirements. And the fourth one is the Safe Medication, Drug and Cosmetic Act. If you are having a pharmacy, we have to follow all the norms given by the NDPS Act as well as the DCA or Drug and Cosmetic Act. The fifth one related to the manpower. So this is where most of the hospitals get caught, particularly the mid-level and large institutions. All the statutory compliance is mandatory. Most of the problem comes with our own staff with reference to ESI or PF or professional tax and gratuity. So we have to follow them diligently. And sixth one given by our the newly named NMC, professional conduct, etiquette and ethics. So that's binding on us now legally. So there are multiple complaints, not only in the CPA forum, but also with the medical councils. In many states, it's increasing. So we have to be very careful about our ethical requirements. Then seventh one is the right of the patient, the consent. The next speaker will be talking to us about this. I will not go into the details. The second major issue is reference to patient safety and medication errors. So safety ensured with accreditation. There is always a plan for fire and non-fire emergencies in the accredited facilities, so that if there is an accident, this really helps not only during the emergency but also safety reference to the fire. And litigation related to emergency is reduced in accredited institutions. So because the systems are in place, so we have to have safe infrastructure, standard focus on patient safety related equipment, CCTV camera, the water tanks are cleaned appropriately, biomedical wastage regulations are followed, and there is a crash cart which is available and accessible in case there is an emergency. The last two are administrative related, tariff related. So there has to be a standard billing and transparent tariff, and this is not also mandated by the standard, but also the insurance company. The fourth one is failure of communication, inadequate consent and medical records. So patient flow have to be seamless in the hospital, and this is the common cause of dissatisfaction. We have to focus on the time taken for care delivery. So I'll be finishing in a couple of minutes. So common cause of litigation is this CCC failure, consent, communication, cost, and not effectively taking the complaints and feedback. So we have to have a system established for this, and we have to master this CCC also, apart from our cataract related CCC. Consent, counseling and communication is very important, particularly if you are breaking bad news. You have to be master of this counseling and communications. These are some mistakes we cannot defend, so we have to have a focus and system like surgical safety checklist to prevent these errors. And these are statutory documentation. We have to maintain them as per the requirement for 6 years for inpatients and at least 3 years for the outpatient records. And these are the mandatory standards for maintenance of medical records. So how does accreditation help in reducing medical legal challenges? Good infrastructure is directly proportional to safe care. Process control, so documentation and good communication skills. Licenses are in place, so this ensures safety in facing medical legal challenges. Good structure and good process gives good outcomes. So accreditation standards help in preventing medical legal challenges by having a good standard of care, and these standards help in reducing the risk and improving the quality. So problems are not stop signs, they are guidelines. Once we follow these guidelines diligently, we can prevent medical legal challenges. Thank you so much.